we are very happy to be joined on the Milford Informer this week by two representatives dealing with different areas of the Milford Regional Medical Center here to talk about a very important event coming up over at the hospital. We're joined by Ann Wilkins, who is the Director of Care Management for Milford Regional, and we also have Celeste Corriveau with us, who is a member of the Milford Regional Patient Family Advisory Council. First of all, ladies, thank you so much for joining us this week.
Thank you for having us.
So this is a very interesting topic. It's a heavy topic, but one that is very important for us to get out there, and I think a conversation, no pun intended, that's important to be had in this community and really across the country. It's a conversation coming up. It's a conversation-ready discussion at Milford Regional Medical Center. It's part of the Conversation Ready project. So first, a question to both of you. Tell us a little bit about what is the Conversation Ready project?
Well, I can tell you in 2010, Ellen Goodman, she's a Pulitzer Prize winner, she co-founded the Conversation Ready project along with the Institute of Health Improvement, and their goal was to make sure that end-of-life care wishes are respected and honored.
And one of the things that really struck me as I was looking up some information about this topic is the statistic. 90% of people say talking with loved ones is important about this particular topic, yet only about 30% of people actually have those conversations. It's a staggering statistic, and it lets you know that this is something, again, that's so important for everyone to talk about, those end-of-life medical situations, yet it's a tough topic to actually bring up and have those real-life discussions with loved ones.
Yes, our culture is geared towards not wanting to talk about the upsetting areas of end-of-life. We tend to, our goal is to have our culture go more towards, as we did with the birthing process in our community, saying on how we wanted to come into our life. Now our goal is to steer as to how we want to exit our life. And so it's important to have conversations, and that's where we're coming out to the community in order to have conversations about end of life. Everybody's basically explaining what matters most.
And so again, this conversation is taking place at the Milford Regional Medical Center on October 24th. We'll get into some more of the particulars on the exact date and time frames of the event in just a bit. But Ann, I want to talk to you about Milford Regional's involvement in the Conversation Ready project, a pioneer sponsor of this endeavor. Can you talk a little bit from the hospital's perspective about their involvement in this?
Yes, we have a palliative care program at the hospital, and Dr. Tina Robakevich runs the program, and discussed with IHI their project and pretty much signed us on, and we really loved it. We really enjoyed it. The nurses have enjoyed it. It's become a real multidisciplinary approach to having the conversation. I think some hospitals worry about having the healthcare proxy. We worry about having the conversation and why that's important.
And the other aspect of this is the Patient Family Advisory Council, Celeste, which you are a part of. And for folks in the community who might not know, tell us a little bit about the council, what you do, and then your specific involvement in the Conversation Ready project.
So the Patient Family Advisory Council partners with the medical center on any quality improvement initiative, anything that we want to have the community's aspect shared with the medical center. And ultimately with this Conversation Ready project, we've partnered with them over the last 18 plus months, and now it's coming out to the community, and we're going to different avenues in order to share this information with the community.
That's wonderful. And another, I think another aspect of this that's really been enlightening to me. This is not a topic that I've necessarily talked about a lot with my family, but in doing some of the research, it seems like a lot of people find that you don't necessarily have to start this conversation when you are at an older age, that once you get these conversations going amongst family members, that sometimes it opens it up to everyone of all ages to really start to get involved in the conversation and start to maybe think about this long-term planning that you wouldn't normally think of in other situations.
Yes, so we actually have advertised for community members to come to our panel discussion, any person from the ages of 18 to 99. And our goal is the conversation should not happen at the end of life. It should start over every decade of life. So when you turn of age, 18 to 21, is where you should start having that conversation with in choosing your healthcare proxy. The kids who are going off to school. You never know when an event is going to occur when you're at school, so it's important to have that healthcare proxy.
And when you think about it, the original advance directive started because of a case, Karen Ann Quinlan, who was a very young woman who accidentally mixed barbiturates and alcohol. So really it's any age that from 18 on that you would need one.
Mm-hmm. And they always say that, so every decade, 20s, when you're 20s, 30s, 40s, 50s, and so on, if there's any major event that occurs, if you get married or divorced, if you go on a major trip, and if you're ever diagnosed with a serious illness.
And I think one of the things I would like to add here is people think, well, that's fine. When it happens, I'll do it. What they don't realize is if they become too confused to make that paperwork out, or if they're incapacitated in any way, you can't do it anymore. Now we're talking about the state making decisions for you, or your family going to court to get costly guardianship. So
it seems as though it's a situation where there's so much emotion involved once you get into the moment where something unfortunate happens like that, and to not have a specific plan in place can sometimes not only be a source of stress for the person who is sick or who is in that end of life situation, but also for family members struggling to maybe decide what the best course of action is when they don't know for sure.
So true.
Is something that can really hurt families in the long term.
It's a gift to give your family to do that, don't you think?
Absolutely, and we find that if you don't have that conversation and decisions are made without knowing what their wishes are, that you make those decisions and then afterwards you start reflecting on what
Right.
could have, should have, and you start doubting yourself, and this ends up having a complicated grief. And that's what we're trying to avoid. And just when the end of life occurs, knowing that you did everything that they wanted you.
So it's a very important conversation to have, and this is a great resource to maybe get that conversation started with families here in the Milford area. So again, just to give all of the particulars, this is the Conversation Ready discussion. It will be held at Milford Regional Medical Center coming up on October 24th. That's a Wednesday. It'll be held from 6 to 7:30 p.m. over at the Milford Regional Conference Rooms A and B. Registration for this event ahead of time is encouraged, just to make sure that you have a seat there ready to go. So registration is encouraged a little bit before the event. I believe October 17th is the cutoff date for that.
Correct. And I just want to also say that we will have refreshments served, and so in order to assure that we have plenty of refreshments there. But again, if it ends up being where you decide at the last minute that you want to come, we will certainly welcome anybody who comes.
Well, it's certainly great to know. And just to set the scene for folks so they know what to expect when they actually come into the door, how will the night unfold in terms of the panel discussions and basically the meat of the event? How will the event be set up?
So we do have Anne, who will open up by sharing again this whole topic as to why we're meeting, the Conversation Ready. And then we will have all different aspects of the life where who has been touched when medical care decisions are made. So having a primary care physician, a physician's assistant, particularly in the palliative care area, a social worker, a lawyer, and a chaplain also.
Mm-hmm.
And then we also have a community member that has a personal story that they'll share with us.
And so from panel discussions into an opportunity for residents who come and attend the event to ask questions if they have some things personally that they'd like to get some insight on as well.
Yes, and we will also have part of instrumental to the project was a Conversation Ready kit and an instructional guide, and so we will provide handouts also. So it's an easy instructional kit.
So it will be a night of again, some very important information to get out there. It might be something scary to think about in the abstract, but just a great opportunity for people to come and learn some valuable information, and hopefully bring that back to open up that dialogue with family members to help ease what is a difficult situation, but it makes a difficult situation a little easier, making sure that you have these proper plans in place.
And it becomes more of a comfortable conversation when you've had, because it's not just one conversation, it's conversations to have over and over, and it becomes less burdensome and uncomfortable when you've had them right along.
And sometimes the hardest part is getting that conversation started, and these are the tools that hopefully you're providing residents to be able to get those started. So we can't thank you enough for coming in. Again, we want to remind everyone one more time, the conversation is taking place at Milford Regional Medical Center coming up on Wednesday, October 24th. It will be held from 6 to 7:30 p.m. and we'll have all the information on our screen, of course, and how you can register for the event. And then again, we hope it has terrific turnout. We will have some Milford TV coverage there as well. So we can't thank you again for joining us. Ann Wilkins, Celeste Corriveau from Milford Regional Medical Center. Thank you, ladies, so much.
Thank you so much.
This is Milford TV News and Sports Director Tim Coet. Make sure you check out new editions of the Milford Informer every Friday at 7:30 p.m. or during one of our 8 convenient re-air times throughout the weekend. You can also find individual news stories as well as full archived editions on our YouTube page, My Milford TV. If you live in the greater Milford area and have an idea for a news story, you can tweet at us using the handle @Milford_TV, or you can contact me directly by sending an email to news@milfordtv.net.